Big development in downtown Indianapolis.
Leaders at Wishart Health Services
Plans to build a new hospital.
Wishart's facilities right now can be fixed with a bandage, but shortly they will need a tourniquet.
A grassroots campaign
called Citizens for Wishart wants to be part of the effort to build a new hospital.
I was caught up in an explosion that burnt 37% of my body. I can honestly say that because of the grace of God and the skilled, loving care of the people here at Wishart, that I'm alive today. Vote for the new Wishart on November 3rd.
The resolution passes.
We have over 100 precincts in. Everyone is for a new Wishart.
We're here this morning to mark the beginning of the demolition of the old hospital, which paves the way for the construction of the new Wishart, a hospital for all of Indianapolis.
The new Wishart Hospital is going after LEED certification.
The new Wishart will care for the environment in the same way that our staff care for our patients.
Wishart will be the first green hospital in the state of Indiana. And of the over 5,800 hospitals in America, we will be one of only 10.
We are doing nothing less today than celebrating the future of Wishart and our continued commitment to quality of care for all in Indianapolis.
This is a milestone that for years to come will be recognized as a defining moment for the Indianapolis community.
Today we kick off our report to our community to report on and to thank you all for the progress that you've made possible toward this new hospital. Without us, there would be no Wishart, and our support is just as vital to our new Wishart.
Our employee giving campaign has received a gift to match every dollar we pledge.
The more we give,
the more they give.
We're supporting the We Are Wishart employee giving campaign
because we believe in Wishart's mission.
When you're building a hospital like Wishart for the people, the art is also for the people and by the people.
We're here today because the art of healing is an important feature of our new hospital that's integral to our overall vision for the new Wishart to lead in patient-centered care.
We are dedicated every day to meeting and exceeding our diversity goals in that, and we're doing that right now. We're ahead of schedule, about 29%.
A record gift.
A $40 million gift for Wishart Hospital today.
It's a gift like no other. The biggest in Indianapolis and among the largest to any public hospital in America.
What a great day for Wishart and our opportunity to recognize the Eskenazis and what they're doing for our great hospital.
That we could do something like that to affect outreach so many people is mind-boggling.
I mean, to find a kid from the South Side that started with nothing and end up helping the people, it's pretty heady stuff, at least for me.
We know that the best thing we can do for our community is to help people stay well in the first place. And so a big part of that is physical activity. It's what we do every day to manage our health. It's being active, it's watching what we eat. And so that's why events like this, both the run and the walk and the health fair that's going on behind us, are so important.
Fifth Third Bank has given a $5 million donation toward the construction of the new Eskenazi Health Hospital.
The donation is the largest gift ever related to a financial institution in Indiana history. The money will go toward construction as well as financial literacy and empowerment services for hospital employees and patients.
The Eskenazi Health project is on time and under budget. And today we will place the final beam at the top of the new Sidney and Lois Eskenazi Hospital.
Just 2 years ago, there was nothing but a bunch of holes in the ground back here. And today we get to place the highest beam on this facility.
I can't tell you how proud I am of the Fifth Third family here in Central Indiana.
A topping off ceremony traditionally honors the progress of the building, and according to tradition, there's an American flag. We also have a Fifth Third flag, which was signed by Fifth Third employees to symbolize their commitment to Wishart and Eskenazi Health.
This is one of the busiest Trauma One centers in America.
Our family is honored to be among the contributors to Eskenazi Health's campaign, and I'm even more honored to be a part of such an extraordinary health system that does so much, so well, and for so many.
No matter the neighborhood, no matter the location, Eskenazi Health is here for you. And because we know the best way to be healthy is to stay healthy, Eskenazi Health is also free neighborhood health fairs.
We made the decision to sponsor the Mental Health Recovery Unit to raise awareness about the stigma involved with mental illness.
Anything that can draw attention to the mental health field is something that we would like to do. We decided now's the time.
This health center is much more than a health center. We think of it as a community center that does health care. We see it as a place that will deliver care, but also a place that embraces the rich diversity of the community that surrounds it and that brings people together.
This building and this center was designed with the health in mind, the idea about being able to focus on the health and well-being of the population, not simply to take care of people when they're sick, but to help them not be sick in the first place.
I'm glad to see this new health center, but more than that, I'm excited about the healthcare system for our community that truly cares about each and every individual. I've had the opportunity to see firsthand the quality of care the nurses, physicians, and the staff of Eskenazi Health provide to patients and to the community.
This new health center is the latest major development in a continuous path of revitalization and community enhancement for the Lafayette Square area, all of which collectively contribute to a better neighborhood and better lives for all of the members of our community here on the Northwest Side and across Indianapolis.
Eskenazi Hospital is hosting an open house today.
It's been a privilege. It's been very exciting. We're going to open on schedule and on budget. Over 10,000 individuals from our community have worked on this construction site.
People stood in line for public tours. This group started in the emergency department. People also got to see the burn unit and patient rooms.
100% of our rooms in this Sidney and Lois Eskenazi Hospital are private rooms. And so you have extra privacy, extra patient safety.
And patient safety is why all of the rooms are exactly alike. In an emergency, doctors and nurses know everything in every room is located in the same place.
Every room in the facility has a sink right here at the opening of the room, and that way the caregiver can come in. First thing he or she will do is wash their hands.
All rooms have a private bath, also designed for safety.
And it's a bathroom that doesn't have a threshold, so if you're in a wheelchair or if you're in a walker or crutches, you can cruise right in there.
But aside from the state-of-the-art design, there is a soft touch for patients and families who in many instances suddenly face the harsh realities that come with a hospital stay. The main hallway is filled with light. There is artwork just about everywhere you look.
Art has the power to reduce stress, which is critical to healing.
CEO Lisa Harris says the new hospital has 20 pieces throughout its campus. Some of the art will be in unexpected places, like the elevator bay.
These trees are soft, they're warm, they glow, and what trees represent is life.
There is even a sky farm that will allow patients to enjoy fresh air and a spectacular view of downtown.
A day of events is planned to publicly dedicate a brand new $750 million hospital in Indianapolis's downtown.
This is a special edition of Afternoons with Amos on a significant date. We are live from the Sidney and Lois Eskenazi Hospital.
Right now, state lawmakers and city officials gathering for a ribbon cutting and dedication.
And it's also the first time that the public will be invited inside.
You have the chance to tour the new Eskenazi Health.
Today, Eskenazi Health, all that we imagined, all that we worked hard for, all that you made possible is here for you.
This is an extraordinary day where we do get to celebrate the opening of the Sidney and Lois Eskenazi Hospital. It symbolizes what Marion County is all about, which is people coming together. And they did so to provide compassionate, decent, and kind care for every single person.
We know that we care about our residents. We know that we care about our neighbors. We know that we care about medical education. We care about life sciences research and the jobs and the support that provides to our city. And we care about progress. We care about building for our future. And this is a culmination of that.
Local residents have been feeling its positive impact for quite some time. That's because in this building, this hospital and campus, 17% of construction contracts went to minority-owned businesses, 8% went to women-owned businesses, and 6% went to veterans-owned businesses. And most importantly, 90% of the construction contracts were with Indiana firms.
Today, with the dedication of Eskenazi Health, we light candles of hope for the economy with the jobs that this will create. Candles of hope for the kind of affordable quality health care it will provide. Candles of hope for environmental sustainability. And more than anything else, candles of hope that our community here in Indianapolis can and will do better.
Although we celebrate this hospital for many reasons, the most important reason for me is that it's going to make a tremendous difference in the health of the individuals of this community.
Eskenazi Health brings so many people together and has such an amazing impact. Each day we feel more amazed, each day we feel more honored, and each day we feel more grateful for the opportunity to be part of something so grand.
As we say goodbye to Wisher today, we also say thank you to everyone who made this place special. Thank you, Wisher, and thanks to all of you. When I got involved in getting the referendum passed, we had so much fun, and everywhere I would speak, I would remind them of a song, "You've been a good old wagon, but you done broke down." Well, now, we got us a new wagon, and Eskenazi is here for you.
Those of us who work at Wishart know the beauty and the challenges this facility has held. I want to focus on the great people who carried forth our mission, the employees and physicians who knew all the hallways, all the quirks, all the special little break fixes to keep running, even when the challenges of a 100-year-old facility kept cropping up. You all, and generations that came before us, made Wishart the special place it has been.
As we are excited about where we're heading and the future we're going to create, it is important, it's necessary to take a moment to pause and to reflect and to express our gratitude for these walls that have supported us in carrying out our mission over the course of a breadth of a century. And so it's time with full and grateful hearts at this time to say goodbye.
A new chapter for healthcare here in Indianapolis has officially begun.
And after 4 years of planning and hundreds of millions of dollars, the era of Wishart Hospital is over.
The old Wishart campus shut down just a few moments ago.
This weekend's historic move between Wishart Hospital and the new Eskenazi Health didn't happen without months of planning and complex coordination.
We put hours and hours of planning together with our Indianapolis EMS and all of the staff, and we have a nice, comfortable, warm ride for everybody.
2.5 hours into the historic move of the old Wishart Hospital to the new Eskenazi. And so far, several of the hospital's most critical patients have already been transferred.
It is quite the rhythm they have going. The command centers at both places are in constant communication with each other. The bed assignments, as soon as a patient gets in, it loads up on both boards, so we know where patients are at minute to minute.
Early Saturday morning, one by one, patients from Wishart Hospital were moved to its replacement.
The first patients were welcomed today to the new state-of-the-art hospital.
Over 150 years of service to our community. We're carrying that idea, that mission forward now in facilities that are as good as the staff.
Ready to move forward to a great new building and take care of the people the same way we always have, just in a nicer facility that was built for them.
Like a well-choreographed play, the ambulances carrying the patients made the 2-block trek from the old to the new.
The historic move from Wishart Hospital to Eskenazi Health is finally complete. Starting early this morning, 149 patients were transported from the old facility to the new one. This massive move wrapped up in just 7 hours after plenty of trips back and forth. 25 ambulances, in fact, from 12 different agencies, helped with the transport. The transition to Eskenazi took an army of volunteers, including members of the U.S. Navy Reserve and the Indiana National Guard. They made sure each patient was moved safely and securely.